My name is Bagasha. I am a kidney disease specialist. I look after patients who have kidney disease. Kidney disease is quite prevalent in Uganda and the world over. The interesting thing about kidney disease is that most patients usually don't know anything about their kidney disease until they present to the hospital with symptoms, and the symptoms tend to come when the kidney disease is fairly advanced. So the symptoms that patients usually have when they have kidney disease include things like body swelling, like reduced urine output. You may be feeling tired and fatigued, or you may be getting itching, which we call pruritus. Your skin is itching a lot, and these symptoms usually come when the kidney is quite advanced. Now, one of the risk factors for getting kidney disease include if you have high blood pressure, diabetes. The importance of screening for kidney disease cannot be overestimated, because if you do not screen, then usually you would not know and you would end up coming late to the hospital. This year we are celebrating the World Kidney Day. The theme for the World Kidney Day is living well with kidney disease. And that is actually what I am studying now as part of my PhD with the Thrive Consortium, the quality of life for patients with kidney disease. And why patients with kidney disease don't live well is because when you have reached the end stage means that you have to have either a kidney transplant or you have to do a procedure called hemodialysis, and both of these are quite costly, so most Ugandans cannot afford them. We take in patients to do hemodialysis. They do it 3 times a week every week because, one, it's very expensive. So many of the patients, we cannot do dialysis, and eventually they will die. So the ones who manage to do dialysis, usually we do it in Kampala and in Mbara. When you do dialysis, you do it 3 times a week. The patients who do stay on hemodialysis, usually in Chirudu, it's the cheapest that we have. Therefore, it's very important to look at the quality of life for these patients, so that when we are counseling them and telling them to start dialysis, we tell them that this is what your life is going to be. That's why I feel my studies in looking at patients' quality of life are very important, because they inform the decisions that patients make, policy makers and hospital administrators make in deciding that maybe we should reduce the cost of dialysis so that maybe more patients can be able to afford it and live well with their kidney disease.